Hi YouTube, I'm back to tell you what happened for my surgery. As you can see, my thyroid is out. My lovely little scar. It's a little jagged right here. I'm not happy about that, but oh well. I had an absolute terrible experience having my surgery done. I had my surgery done at Kaiser with a surgeon named Dr. Bab. If you are a Kaiser patient, you're in Northern California, I would not suggest going to him ever. The man is absolutely terrible for many reasons. I had my surgery on a Friday, and he did my surgery and then left. I never saw him again. And I was admitted for low calcium, which I guess is quite common, or can be quite common. And whoever he had taking his place, had no idea. I was like, oh, so how'd my surgery go? Just regular questions. And he was like, I wasn't there, but, everything went well. And that was it, and it was like, okay. Zero communication. It was so, I didn't know anything about my surgery until I ended up talking to my endocrinologist, I think a couple of days ago. I think it was Thursday last week. That's how long. So he took off, and I ended up finding out after the fact he went on vacation. So, and I couldn't get a hold of him. So if anything happened, anything, yeah, of course they had somebody on call, but then his nurse lost all my medication, and I had low calcium. And I didn't know this, but if you don't have enough calcium, you can have a heart attack. If you have too much low potassium, you can also have a heart attack. Your minerals are very important. But I went home after 2 days of being admitted, and my hands ended up all of a sudden just going in like a crab or a lobster. They were like this, and then they went totally, it was crazy. And then my face was my feet, hold on, you want me to do that? You want to see me do that again? So anyway, I'm kidding. And then my feet were doing the same thing. They were curling in, and I couldn't take myself to the hospital. And my friend, she called 911 because my hands, I'm serious, they were bad. And ended up going back to the ER. Went back to the ER, and the doctor told me at Roseville that was there that everything was in my head. And I started sobbing. And the nurse came in, she goes, "It is not in your head." She literally told me, she says, "Not in your head. I just saw your labs. You are low on calcium. You need to bump up more on your calcium." And I'm literally, because I felt like I had a mask on, a raccoon mask, my face was all buzzy, and my eyeballs are, and this part's going, and my hands, I couldn't even unfold my hands. And those of you that have had this before totally can, empathize. It was horrific. And I can believe that doctor told me that, and I'm sobbing, and the nurse was like, I'm so sorry. And I went home, and then I thought, well, maybe this is just normal after surgery, just to be like this. So I was like that for 24 hours. It kept getting worse and worse. And the next day, I'm just I need help. I was so bad. It was horrific. And I went to a different ER. I went to Kaiser Morse, and they had me in, and my heart rate was at 46. And they were like, oh my gosh. And they had hooked me up to all this EKG and heart machines and all this stuff. And they were like, she's about to have a heart attack. And they ended up finding out, doing a lot of digging, that The doctors at Roseville Kaiser never prescribed me calcium in the first place. So all in my head, my butt. I'd like to kick that doctor in the face. But yeah, it turned out that they found out that they never prescribed me calcium in the first place at all. Never told me, never nothing. And they lost my medications, the nurse. So I went home and they didn't give me any of my medications, any of my pain medications, any of my thyroid replacement medications, nothing. Ibuprofen, any Percocet, nothing. So they couriered it to me on a Sunday evening because I called and threw an unholy fit. So they admitted me, well, I'm sorry, I got a little ahead of myself, but they admitted me when I was in Kaiser Morse into the hospital again. And they gave me, I mean, you should have seen it. I got 6 bags of calcium. I was so low on everything. You should see my labs. It was bad. My potassium was low, my magnesium was low, my calcium was low. And then they gave me 6 bags and I still couldn't even get to the point of being in the normal range. Normal, I guess, was 8.8. I couldn't even get there. They gave me 6 bags and then they're just giving these stuff to make it go faster and tighter or whatever. And it's burning and I'm like, oh my gosh. And then it was terrible. And then they had figured out the mystery about they didn't even prescribe me calcium in the first place. And so they finally get me almost within normal range, not in normal range, almost within normal range. And they need the bed space. And so they discharged me. And the doctor over at Morse tells me, you know, I've prescribed you some calcium. And it was supposed to be this different type of calcium. And I said, just for, please, I've had such a roller coaster ride with Kaiser. I would really appreciate it if you could just double check that the pharmacy has the calcium, you know, to allay my fears. And he was so cocky and snarky. And he was like, this is a pharmacy. That's like asking if they have Tylenol. Well, guess what? Turns out that they didn't have calcium. And then they ended up prescribing me Tums, which I know has calcium citrate, but it was not what they, you know, their first go-to that they wanted to give me. So, needless to say, the cocky doctor, yeah, pride goeth before the fall. That guy was so cocky. And then I was mad. I was crying in the pharmacy and I was like, are you telling me you're giving me Tums? I'm like, so this whole time I could have just took Tums and this would have been, I wouldn't have been like this, like frozen in my face. And I was just sobbing. And the poor pharmacist, he felt so bad for me. He's like, we should have done better. I'm so sorry. And I'm like, how could you? I should be home resting. So I didn't, needless to say, I really didn't get to rest. I didn't even get nothing. My kids were back. It sucked. It absolutely sucked. So I was home and then I put in a complaint into Kaiser and then boom, my surgeon's calling me. I'm like, I'm not talking to you. I'm so mad at you right now. I could just spit. I was mad. And so I could not speak to the man. And then I guess my pathology reports came back. And my pathology reports, finally, I answered the phone, I think like a week later, because I needed to calm down because I was mad. And he tells me that they found a 5 millimeter carcinoma in my actual thyroid, and then there was something carcinoma in my nodule. So I had cancer and cancer. And so but my margins were clear, and they checked my parathyroid, and blah, 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 and no need for follow-up, and I'm totally okay. So I'm like, yeah, I was at the park with my kids, and I'm like, yeah, we're going to BJ's, we're gonna get a pizookie, and because they have gluten-free pizookies, and we're gonna celebrate, and mac and cheese, and let's go get some let's go celebrate, woohoo, mom had cancer, didn't even know it, and beat it, and never guess what, good old Dr. Bab, good old Dr. Bad. I ended up having a visit with my endocrinologist the other day, and the endocrinologist was like, so your thyroid had a lot of inflammation, and in 6 weeks we need to do tumor markers. I'm okay with you not having radiation right now. How do you feel about radiation? The risk versus benefit. It can damage your salivary glands and damage your tear ducts and all this other stuff, but in 6 weeks we need to check for tumor markers, and if you still have tumor markers, then we still need to do radiation. We're going to have to follow you for the next year. We're going to have to do ultrasounds and all this stuff. And I'm like, that's not what Dr. Bab said. Dr. Bab said, oh, your margins were clear, there's no need for follow-up, you're totally okay. I mean, granted, my endocrinologist, who I do trust, said there was a low occurrence and all of that, but that was not even close to what Dr. Bab said. Dr. Bab was like, oh, your margin's clear, you're okay, go party, girl. I just night and day difference. Night and day, I was like, I'm talking to two different people. This is two different patients. So if anybody is an administrative person over at Kaiser, Roseville, you need to drug test Dr. Bab, okay? For real. I'm not even joking. So, yeah, so that was completely, oh no more candies. Sorry. And so that was horrific. So as far as my scar, it hurts. It hurts to talk a lot. Hurts still to the touch. It's tender. Touch, hurt, tender. I don't know. It's kind of jagged a little bit. All I know is that if anything else, they need to go back in. I'm not having Dr. Bab touch me. I definitely, I'm gonna start my steroid strips completely, like the last of it came off yesterday, and I'm gonna really start putting some sunscreen and on like my vitamin D and all of my oils that I do for my face and all the other fun stuff. I'm gonna start really getting on that to try to take down any scarring and stuff. So I don't know if you can see it, but I do not have the huge nodule anymore, but I am thankful for that. It was hard to swallow the first couple of days. Definitely should have had that more prepared, like jellos and broths and soups, and it didn't hurt on the inside, like sore throat, strep throat type thing. It just hurt on the outside. You're like, oh, it's just a different type feeling. I mean, it's not bad, but it hurts. It's not anything that you can't go through. I mean, if you've had children, I mean, this is nothing, but it does hurt. But I don't know. But I do want to say that the one thing that I have had is my joint pain immediately went away. Immediately. Right after surgery. I do not have joint pain at all anymore. I believe I'm on 125 milligrams of levothyroxine. They just did labs on me a few days ago. My parathyroid hormone, she said it was a little early, but she still looked at it as totally bad. It's in a really bad range. I'm really getting really funky facial stuff still. So like my eyes will twitch all day and my nose will twitch all day. But my calcium is in normal range now. It's 9.3. But I was taking a bunch of calcium all day. I was taking 2 pills, Tums, 6 times. I mean, 2 pills 3 times a day. And then sometimes 8 pills. But I stopped taking it because they said it was fine. But I still get like, so maybe everything's just trying to adjust. And my hands, like the other day, I was holding the steering wheel and they were like stuck. And I don't know, it sucks. Drinking coffee, I noticed I drank coffee yesterday and I drank coffee about a week ago. And after about an hour afterwards, my hands would start to and I know they have a tendency to chelate your minerals, so that's kind of fun. But if I had to do it over again, I would do it, absolutely, but not with Dr. Bab, because I have no idea really how my surgery went, really. I still kind of don't know. Hey, all I got was, look right, I guess. But that's about it. But that's what I was gonna report back. If anybody has any questions about what I did. Oh, ice. I did a ton of ice in the front and in the back. That helped, booty. That helped a ton for the front and the back because the way they have your neck, like all, and that really, really helped keep the pain, because the back of your neck really, really, really hurts, and of course so does the front. So having that constantly, especially when I was in the hospital, was a lifesaver. But other than that, it's doable. It's totally doable. If anybody has any questions, let me know. Okay, God bless. Bye.